Welcome to San Diego and welcome to the Consortium for Advanced Practice Providers 7th Annual Conference. We have close to 200 attendees, but 60 of them are brand new programs. I mean, really, to have 60 new programs launching in September is pretty incredible.
60 new programs coming together to learn from each other. Best practices for creating, maintaining, and developing postgraduate training programs for nurse practitioners and PAs.
This year's theme is collaboration, support, and community, and that is really what this conference is all about.
Definitely that sense of camaraderie. It's a lot of collaboration, it's a lot of sharing, it's a lot of this is what worked for me. Maybe it will work for you too.
I think the ultimate goal of QI and the ultimate goal of being a healthcare provider is to improve patient outcomes.
You know, this is still an evolving, rather disruptive thing we're doing, setting up postgraduate training for nurse practitioners and PAs. So by learning from each other and helping each other and being open to all the best of everyone has to bring, we're going to move this movement further along together.
I often say what started off as a model has now become a movement, and everyone in this room today is part of that movement.
It helps me realize that I'm not creating the wheel by myself, that there's people with lots of resources that have either been in my shoes or in the same exact spot as me or coming up behind me that I can help in turn.
For those of you that have been in NP for a long time, yes, we can still not order diabetic shoes.
Our opening keynote was on the evolving roles of APP providers and how we can go from primary care and acute care to leadership roles.
Advanced practice providers are very well positioned to lead and innovate in healthcare and academia. In fact, we're already doing it, but we need more of us to do that.
We have people representing hospitals, federally qualified healthcare centers, rural clinics, all kinds of settings toward the same goal.
Take advantage of those horrible failures because they really do give you the opportunity to turn it into a massive added value to the program for the residents and the preceptors.
We had a great session on JEDI, Justice, Equity, Diversity, and Inclusion.
Are you skilled enough to interrupt your bias before you make a decision, create a policy, interact with someone who may not share an identity or an experience as you? We all have bias, but it is our responsibility to check it.
We had a great conversation on climate change and how it's affecting APP postgraduate training programs and healthcare and what steps we can take to move forward.
This isn't some esoteric topic that scientists talk about and do, advanced climate modeling on. Like, this is all our lives and it impacts everything that we do.
We had the opportunity to have a certified Lego instructor.
If you think that all your intelligence resides in your head, I've got some news for you. Your hands can be pretty smart as well.
I would say it definitely got people out of their comfort zone and they enjoyed being able to see how someone else maybe took a different approach to building the Legos.
Take home with you what you built, a reminder of something that you have learned about yourself that you're taking away from this experience and also this conference.
I love the new format of having informal expert tables that attendees can rotate through and ask questions. It was really great getting to know them. I was presenting at a table, but I learned so much still, and so I thought that was really great.
The consortium is a standard bearer, it's an accreditor, but it's also a convener, and it's a community.
The highlight of the conference for me is seeing people make connections that they take with them well beyond the conference.
This is the most collaborative conference I've ever been to, and my favorite part of coming to this conference is networking.
You could just feel the energy of the conference really coming together as people forge new connections.
The consortium to me is like a community, a network, a wealth of knowledge and access to people that are in the same boat.
Sharing best practices with each other has really allowed us to strengthen our own curriculum and really create a stronger program.
It's very easy to feel alone, especially when you're starting a program, but every time I asked a question, I felt like, yes, we've been there, we know what you're going through, and we're going to help you.
The consortium continues to grow, improve, inspire, and to lead.
If you're a new program, come, you'll get some advice. If you're an existing program, you can share the wealth.
Help new graduates build confidence and competence to deliver excellent care to the communities we serve. That's the goal, right?
I can't think of a conference I've ever enjoyed more. It's fun, full of energy, inspiration, great ideas, and people are here because the best careers in the world are nurse practitioners and PAs.